Last but not least, I would like to request Dr. Neil Loftus from Shimadzu, UK, who is our own biopharma hero. So, Neil will take over from me as the moderator of this mother of the panel discussions. Neil, dozo.
Thank you. Thank you very much, Brad. So, greetings everyone. I hope you've enjoyed today's Biopharma Summit. And the next hour, because it is Prem's timing, so it has to be precisely 1 hour, I'd like to say thank you very much to all the panelists today. This session really is all about the regulatory challenges that face biopharma. And one of the really interesting things that I just realized seeing the talk from Rena was that in her survey, she was talking about how half the people see the regulatory challenges as being one of the major factors that will affect growth in biopharma. I think that's really important. So what I'd like to do is just really shape this discussion so that we can get some conclusion and closure from today's talks. So first of all, let me just highlight a few things in terms of Shimadzu's capability. So the next slide, please. Because I don't have a clicker. So we're going to have to ask someone from the lab to do this. So let me just share with you what Shimadzu Corporation is working on in terms of the biopharma capability. So not only do we have the liquid chromatography platforms that we have that can address various modalities from glycan analysis to peptide sequencing, we have mass spectrometry to make this work, whether that's MALDI, triple quadrupoles, or even in the ICP-MS technologies that we have. But binding all of this together is an informatics platform, the lab solutions, client server, and as you've had an opportunity, we've got the biopharma over there. So, if I can ask you to flick the next slide, please. So, the way in which I want to shape this panel discussion now is really reflecting and reinforcing the messages that you've already presented earlier today. So the area that I really want to focus on is really about the discovery area of biosimilars and innovators. Next slide, please. And it's just reinforcing the messages that you've all presented to us in very elegant and eloquent fashions. But if I just reflect on last year in terms of the drugs that were submitted to the FDA. So in total, we had in 2006, there were 7 new biological license applications that were approved in the US and the FDA. Now the regulatory framework that governs the FDA, EMA, CDFA, WHO, are really, really important for the development of biopharmaceuticals. In the previous year, there were 12 biological license applications. So on average, there are roughly speaking 12 new biological license applications granted within the US framework. Now the US framework, the FDA, is slightly more advanced in terms of the time frame it takes compared to EMA and CDFA, but things are changing on that way. My next slide, please. So what I want to do in this kind of panel discussion is really try to look at the things which are different between the EMA, WHO, and the FDA in both innovators and also in biosimilars. So these are the key areas I want to really focus on. So the great similarities, but those differences are quite significant. We need to look at how we could work together to make that happen. I was really impressed with the speakers today, identifying those problems, whether it's innovators or whether it's to the biosimilars, and how it can affect China, which is different again. So I'm hoping we can have a big open discussion for people. Wow, I've got a clicker. So the first question I'd like to pose to everyone is really, let's talk about the innovator. And this may well go to Dr. Oda in particular. You know, what are the regulatory challenges for the innovators? You know, what are the things that really do limit the rate of progress? And what are the things that we think could actually make the whole procedure a little bit easier? You mentioned quite a few things in the talk already. I'd really like to speak a little bit more about how you see regulatory pressures, whether this is such an issue in terms of getting products now. There's one microphone here.
Yes. For instance, in terms of biologics I would like to focus on.
Yeah.
So let's think about 20 years ago. That time we had protein drugs. Then at that time we had a big discussion. What kind of data we should provide to health authorities? At that time, analytical technology was very much limited. We could provide only a few data. But then, 20 years later, today, so analytical technology was very much advanced. So we can analyze protein or antibody drugs more details. Then we can provide more and more data. But health authority also require us to submit more data. This is kind of chicken eggs. So when we had a limitation of analytical technology, our providing data is very much limited. So regulatory authority understands the situation. So hurdle is lower. But Shimadzu Corporation developed new technology. Then regulatory authority, their hurdle is getting harder and harder. So always it's never ends this type of discussion. This is kind of my personal opinion.
Thank you very much. May I ask the opinion of our esteemed guest from China? How do you feel the CDFA is addressing this?
I think we are facing the same kind of challenge for innovative development, because as the regulatory agent, they always want to have more information, more data, to make them feel your drug is safe and effective. But for the developer, actually, we have the pressure to move the product forward quickly, as quick as possible. So that's basically the conflict. But I think we try to basically address the common issues when we develop it first. And then back to this challenge, I think communication is still the key. You need to learn how to communicate with the agent, and not really just prepare the whole package ready and just submit. So most of the case will be questionable. And you got to, especially even you start to develop a new drug, you probably show the whole strategy and talk to the agent and see what's your plan. Is this plan reasonable and acceptable, and got the feedback from them. So starting the communication process, and when you move forward, they can better understand you. So that will reduce the challenge. That's what I feel. Thank you.
And today we heard about the work that you've been doing in Thailand, where you have the World Health Organization. I'm also curious about how you feel about the World Health Organization and harmonization, because we hear from China, they're following more of an FDA approach on biosimilars and innovators, whereas in India, you were doing more on the EMA. So how do you feel about harmonization?
Thank you. I'm feeling that whether I'm in the right forum, because from working as a NCR, National Control Laboratory, to support regulators, I feel like I'm still regulated, even though I already retired. Just to say like this, the harmonization is a good tool, as I mentioned in my session. Try to find a common procedure to make the registration process and the data submission for registration process that can be applied in different parts of the world. However, still more and more case-by-case basis consideration required. For example, in the session of biosimilar, there was a question about how many batches that require for compatibility studies. Of course, 3 is minimum according to statistical principle. But sometimes you have to think beyond the statistical analysis. It depends. First of all, do you have the information to compare the drug substance of biosimilar to the originator product or not? Sometimes it's not possible for the biosimilar to get the drug substance. The second point, can you follow exactly the same production process, which is not easy because the originator cannot be able to provide you because it's that confidential information. So this will take into consideration, and also the outcome of your primary structure of the product characteristic can also provide some question to do further higher order of characterization. So we cannot, as a regulator, cannot say that we need this data 1, 2, 3, 4 for some case, especially for biosimilar. However, there is also attempts at the international level try to share information as much as possible amongst the regulators. And also WHO now is trying to work through what's so-called the good regulatory practice to convince the regulators from developing countries with the limited experience to use the recognition system to the stringent regulatory authority. But to do this, there needs forum or the vision of understanding for two-way communication, so it's not easy. I can say that if the innovators know very much about the gaps in their development process and work in collaboration at the early stage of development with the regulators, is the way to reduce the gap in the time consuming for registration.
Thank you. So my intention in this panel is really to split the kind of discussion into 3 parts. One is on innovators, the second part is on biosimilars, and then the third part is really specifically focusing on Paul and his academic possibilities, which I'm totally intrigued about. So do we have any questions from the floor on how you feel about innovators and regulatory constraints? So any questions from the floor for our esteemed panel? If you put your hand up, I'll get a microphone to you. So in terms of innovators, the audience is very happy. So we can move on to the biosimilars. That's good. So let me kind of introduce the next session. Really, it's all about how we see regulatory challenges in terms of biosimilars. So again, if you look at last year, and we look at how biosimilars were influencing the US market and the European market, the 2 big things that really came out of last year was that oncology was the main focus, the main therapeutic domain for a lot of the biologics. The second thing really was that when you looked at the FDA submissions, about half were actually from big pharma, and then another half were actually from smaller companies. So the shape of pharma is actually changing quite a bit. So when we look at the biosimilars compared to the biologics in oncology, we're seeing a way in which the FDA is moving very quickly in terms of the regulatory process. So they've got accelerated pathways, ways to fast track the regulatory process. And we must be aware of the terms that we're using here, because we can be aware of biosimilars, biobetters, and we must always refer to them as the innovator or reference molecules as well. So the key thing really here is that if you can make a biosimilar that works in an effective way, and we've had some great conversations today about what is similarity and how you judge that, then these could be very cost-effective medicines which could have a greater therapeutic modality as well. So So what I'd like to do now is just setting up the next question, which is really about the similarities. We're looking at biosimilars. It's looking at the process that the regulatory pathways view. So there are big differences between the innovator pathway and the biosimilar pathway. There are different ways in which you have to, as a business, change the way in which you look at things. So there's changes in how you characterize the product and how you work on the clinical and non-clinical aspects of the development. So we've seen many numbers today, and this is probably another set of numbers which are different from yours. But if we actually look at some of the things, so in the US we had last year, in 2006, the calendar year, you had 6 biological products that went through the BLA process in the US. That compared to 34. But if we look at the pipeline in India and China, the pipeline in China is truly astonishing. With, in this data set, it suggests it's 361. It's an amazing prospect, so I will focus on China for one of the questions for sure. But then look at India with 64. Such a huge number of products. Is that going to be a huge task for any regulatory authority to even consider looking at those kind of volumes? So it really is quite amazing. And then there is a big number here of 1,454. This is the number of biosimilars that have been around. It's a really changing landscape. And the regulators have to change as well at the same time. Very quickly, there are lots of documents which are constantly being changed and updated. So if you look at the FDA and EMA in particular, the EMA is then adopted by the World Health Organization for biosimilars. There are great overlaps, but equally there are areas which are very specific changes, and it's a big problem. So my next question for this phase of the panel discussion is really, what are the critical regulatory challenges for biosimilars? Now I'm going to go straight to Alok, because you gave a great presentation. How do you feel about the regulatory challenges for biosimilars? What's the thing you'd like to change more than anything else?
One of the things which in regulatory landscape for biosimilar happened was EMA. EMA brought a lot of guidelines which provided a lot of clarity to the biosimilar manufacturers or biosimilar developers, which had helped a lot of companies across who were targeting Europe or who were planning to set up their product development plans accordingly. US was later, it came with clear-cut guidelines. Still, as I discussed this morning, in this afternoon also, even those guidelines like tiering approach for quality attribute classification is not foolproof. It's still, there are gaps which can be challenged, which can be scientifically needs proper justifications. One question which we also heard, and we also asked the same questions to the FDA, how many batches? Because that's the thing which is entirely dependent on time. It's time consuming. You can push your product development faster, you can stretch your working, but if you are only getting 3 batches of innovator in a year, how will you collect 70 batches? How will you collect 40 batches from market if those are not available in market? So in terms of minimal expectation, at least agency should pinpoint that this is the minimal expectation. If you have differences, you should add another 10 batches or 5 batches. If you meet it, fine. If you meet only, if you differ only on certain parameters, you have to do this rather than repeating whole exercises for another 25, which is still missing. One more point which can help biosimilar manufacturers from agency is quick review processes. As you said, rightly said, if you go to agency and say, I need next month appointment, they say, boss, we have 30 more applications to finish. And agencies are also working in multiple shares somehow. So they have made multiple teams to handle this upcoming lots of biosimilar applications. So they have made multiple teams who are addressing these applications and providing advices to manufacturers or biosimilar manufacturers. But at times, when you ask pinpointed questions, they say, you come with the data, we will review and discuss. So until that clarity comes in, it's difficult for any manufacturer who is targeting its completion of development cycle in 7 years or 8 years. It's difficult. Why I say difficult? Until you have some clear goals. Agency is not talking about how will you deal with if innovator changes its process in between your clinical trial. What will you do? Are you ready to change your process when you have initiated your phase 3? If answer is no, or let me think and we will discuss the data, then it's difficult. Because what will happen if innovator says I am withdrawing my product from market? Is there some compulsion on that? If any innovator says, okay, from tomorrow, for example, today we saw Ravi showed one slide where I think 80 erythropoietin are under development. If tomorrow Indian says, okay, we stop manufacture of Iprax from tomorrow, then those developers would be in suit. Who has to get the material for clinical trial, innovator, what will they do? Because Amgen can sustain on darbepoetin, second generation molecule. But what about people who are targeting first generation molecule? So there are challenges which needs to be understood better. And one of the examples of this is now in India we only get Mucogen. Mucogen has been withdrawn from Indian market. So people who might be developing, they have to import it from Europe or US or any country where they want. So there is no such guideline that you cannot withdraw. They are withdrawn.
Good. Ravi, I'd like to hear your opinions.
To add on to what Lok has mentioned, especially with the US, when we talk to the US regulators, they have this strategy of one size doesn't fit all. So what they say is, you come with your data, we analyze and we tell you the gaps. That itself is a big dilemma, and it's, as Alok mentioned, you do all the work and you go and you get surprises during the initial meetings or the meetings later. That's the time which it comes with a big cost and time. So, and that's from the US point of view. But even the other regulators, I can talk about Saudi Arabia. They have their own, even though they say they adapt EU regulations, but they have changes made in their own way. Example, biological endotoxin, the WHO has a limit. There is a number if it is an oncological drug. That number is given by WHO, but not every agency has followed that. Every agency has their own perception of way of looking at limit that has to be on biological endotoxin. That's just to give an example of that. So, for a manufacturer, not only biosimilars, different whoever is in biologics, it becomes a bit challenging. So then it has to be. You may end up actually having specifications different for different countries. That itself, maintaining those many specifications and updating them itself is a big challenge for any manufacturer.
And may I ask the opinion of China with its?
I'd just like to show the unique challenge in China from people doing biosimilars. I think for FDA, they have actually, I would say, enough or rich information from the innovators when the innovator, submit all the data to FDA for approval. But in China, the CFDA really does not have many data as the FDA has. And that's actually bring the challenge both for the developer and also for the regulatory agency. Because how they can be convinced your product is a safe as I mentioned. And unless you're lucky and find some batches which give you the broad range, then they will accept it. Otherwise, they will just keep challenging you. I think that's basically, as I mentioned, it's a limited information. And also, I think the other challenge is actually regulatory reform. I have to say, actually, I will give the big credit for the Chinese government for the past 2 years. Because 5 years ago when people started developing biosimilar, as I mentioned, they took about 2 years to get the R&D approval. And right now, it's 6 months already. So the policy is really encouraging, but the challenge associated with that, they still take time to get those policy become practical. And for example, for all these testings, it actually was conducted by the Chinese government to evaluate the product. It's not like you submit the data after they evaluate, they repeat your experiment. And now the policy is like, after 60 days, the developer can start their clinical trial if the CFDA does not give you the response approval, just like US FDA now. But how can you imagine, the government, experiment labs finish all the experiment within 6 days? So the policy is very encouraging, but the realistic world is quite different. That's the understanding. And in China, it's, in US, like FDA or EMA, I would say most likely it's based on the science-based decision. And in China, it's kind of different. It's actually policy-based as well. It was really pure policy-based before, and now it's much, much better. But still, for example, when we actually help to develop biosimilars, the first impression I got from the agent is that, if you are not the top 5 biosimilar developer, you have a very little chance to get into the market. I mean, basically got approved. And based on our values, like it's all equal, business. The one who have the better quality, should be the winner. But at that time, it was not the same case. You have to fight for the speed. If you, just like the 7th or 10th biosimilar developer for the same target, and you basically lose the business. So that's kind of, they are actually trying to move toward the FDA and EMA, as I mentioned. For the past 2 years, CFDA had a dramatic reform. And I think even for our regulatory affair expert, it's hard for them to follow all the guidance. So it's even harder for analytical guy or QA guys, but which is a good part. But also it's bring all the challenges. And we think the government shouldn't involve much on the economic wise, how to, but they believe they cannot. The whole country should not waste your resources for the same target biosimilar development, which also makes sense because some bad example happened in China. Everybody trying to make an EPO and then dramatically drop the price, and the government thinking that's the bad thing. So from the regulatory, they trying to discourage you to do the same thing.
I have one more question for you. Do you think there will ever be a really good definition of similarities?
The good definition? Yeah. It depends on which class, which level. As I mentioned, the last slide, I still use that example. We think it's kind of dramatic change happened in the innovators. But when you deeply think about that, and then when we talk about the glycosylation profiling affect the ADCC activities, all that. And then when we did the animal study, we didn't see the much difference. And then we come back and say, okay, we shouldn't see much difference because the toxicity, the cytotoxicity actually mainly from the payload, the small molecules. So the ADCC effect on the antibody actually does not that matter for the ADC itself. It does matter for the naked molecular antibody, but not really. So that's why I think Genentech we keep changing those profiles, but still not approved. That's what we think, and that shouldn't be a big concern, even there's the similarity is not that good. On the other hand, as I mentioned, some like the subsequent difference, it shows a dramatically adverse impact on the safety. So I would say it's really hard to give a general definition for the similarity.
So, are there any questions from the floor for our super experts on biosimilars? You see, you're so good. Everything is explained good. I have a question for you all. I'm going to see how dangerous this can be. If you had a wish, and you had to say that I want some new technology to help my process go forward, what would that technology, what are you missing from your current technology performances?
Well, one thing quickly came into my mind is actually not trying to do a commercialization for Shimadzu, but actually we collaborated with Shimadzu in the biopharm field, and the triple quad applied on the process development, like the medium optimization. I think it's pretty good area because for a lot of biopharmaceutical companies, they really don't spend a lot of effort on the medium analysis. It's mainly based on experience, and some are related, just limited to the HPLC. But I think the mass spec can play a pretty, a great role to get the better detailed information. And we just started with Shimadzu and trying to find develop some new analytical method and help the developers. I actually asked my colleagues and other peoples in the biopharm field, and they all think that's a pretty good technology that can be developed, and it will replace the HPLC and get better feedback.
How about you, Alec? Are you missing anything?
Like we can get a virtual tool to predict residual uncertainty based on the data or information which we feed in, and then we can see that this would be the residual uncertainty number 1, which you have to address, number 2, number 3, and that may have a great detail that something critical is not missed out during your disk mitigation. That would be one of the things which can be predicted also based on the literature and data set, and one software or something can be predicted. I trust that.
And Dr.
So if technology is disconnected or separated from science, that is a problem. So technology has to provide scientific evidence. For instance, regulatory agency or health authorities, they may change their regulation policies based on scientific evidence. For instance, biosimilars are just similar, not the same as original molecules. So biosimilar companies has to provide scientific evidence. Our biosimilar molecule is basically the same frequency to original molecule about side effect or severity of side effect. Otherwise, you cannot explain to request to regulatory authorities. So technology and science unite together.
There are these two areas which I can think of being being in manufacturing, there are a lot of analysis we do offline. We take samples, we do offline. If we could have solutions where everything can be checked online as the process runs, so we'll have a real time of the feedback coming in. So that's where there's a lot of scope of putting in the new technology into the process. I wish we have that for every single test that we want to do. That's one. And as extension of that, data analytics is the other area which is coming up now. Even we have hired data scientists. That's the new where that everyone that's a field at least I could see is coming up in my part of the world. Because we understood the importance of the historical data and how much we can use the historical data, and then coupled with some artificial intelligence so that it analyzes the data. Again, then big data comes in, it analyzes the data and then understands and then give a feedback real time. That will help minimizing the variations that we can possibly make during the manufacturing.
Thank you very much.
You use the term wish, but maybe not come true. So, first of all, because I'm from a developing country, the technology should be kind of affordable. And of course, as the other speakers mentioned, that should be provide a precise, reliable information. And the technology should have the tool or mechanism to compare the result across the different places in the world. So the term technologies in my mind is not only one technology, and it's not only about the methodology, process, or equipment, but it's also how to prepare a kind of reference material. So this should be combined to get the reasonable and a good technology to overcome these challenges that we have been talking. And just to use this for advocacy, WHO just adopt the first international standards for rituximab and infliximab. And somebody asked about how to get the reference material. This international standard can be used as a comparator for calibration your working reference material.
Well, I've got a special session for you. No, thank you very much. So, my last kind of session is really trying to question our keynote speaker today, Paul. I thoroughly enjoyed your talk today, and I thought that you were shaping things in a different way. It was enabling us to think differently. So when we look at big pharma, we look at the attrition rates, and our modeling for making small molecules work. There's one drug fits all people. It clearly has got so many different challenges, and your outlook was really enlightening today. But I'm really intrigued, how do you really see academia working with all of these IP issues, trying to identify different gaps? Your model sounds really exciting. The way in which you've done this at MIT is really thrilling. How do you really see that in the next 5 to 10 years, really making an impact? I'd love your views also.
So I think there are sort of maybe two ways that pre-competitive work can be impactful and not have an IP issue. Right? And the first way is you have to really identify a problem that impacts all of industry. Right? And when we talk about molecules, maybe not so much with biosimilars, but with innovator molecules, the IP is generally around the molecule, right? And so how they make that molecule, how they make that molecule safely, right? All of those things are outside of that competitive space and are areas where you can bring industry, academia, and government together to potentially identify solutions to pressing issues in that space. So I think that's one way that pre-competitive pre-competitive collaboration can impact that, is really identifying those spaces. I think the consortium I actually didn't talk about in my talk, the consortium on adventitious agent contamination, that consortium's sole focus is safety. And I would hope that we as an industry would not consider safety to be a competitive advantage, right? And if that's really the case, then safety should be paramount for all of the industry. And we should come together to find solutions to that and ensure that all products are safe, right? And so I think identifying issues like that that are very, very important to the patient and to the companies are very key to making those things work. To your question, which focuses on technology, how can we accelerate regulatory acceptance of new technologies? And I think in my limited, as a naive academic, my limited interaction with regulators, what I see in terms of their hesitance to take on new technologies is really lack of experience. They don't really understand, they see this new thing, and they don't quite understand maybe how it works, how it is applied, or how what the data that's coming from this new technology compares to existing approaches. And so one way that academia could then help to build that gap is to collect data to familiarize regulators and industry with these technologies. I think maybe one example from something that I'm thinking about is there's been a focus, again focusing on adventitious agents, there's been a focus on an interest in using high-throughput sequencing as a potential way to detect virus contaminations, right? There's a lot of regulatory hesitancies in that. And I think really the reason why there's a lot of regulatory hesitancy is they don't have experience in seeing it used in a situation that mimics what a GMP environment would be like. And so having academics begin to collect that data and build up a data set that companies could then go to them and say, look, there's this data set that supports us from a scientific, risk-based perspective that this is an effective matter, and we have this extra data that supports our own process. I think that's a way that academia can very much impact things in a free competitive way.
Because essentially the FDA is a very rigid model. It's been going for many years on small molecules and trying to adapt to the new larger molecules has been a big change for them. So do you feel as though the FDA is with open arms to such things? Do you think they really want to get on board with this, getting academia and pharma? Three-way discussion?
Yes, I mean, so we regularly interact with regulators. They are interested in engaging with us around these issues. I think the FDA in particular is interested in becoming more familiar with new technologies. They founded this emerging technologies group, the CTT, to really have people bring the new technologies so they can see them early on. And I think June pointed out, that pointed out earlier, having communication, regular communication with the regulatory authorities can smooth these interactions. And there's ways to do that early on and get their feedback and input and make changes. And I think it was mentioned earlier also that the FDA, repeatedly, if you talk to the FDA, they say, well, we'll take that on a case-by-case basis, right? And on one hand, that's incredibly frustrating because you'd like an answer, right? But on the other hand, I think that I would throw it back out there that maybe I would argue that we as an industry don't want you to be too prescriptive because then it ties us into doing things a specific way every time. And that maybe that would stifle innovation and stifle the ability to get products out there. But to answer your question, I think the FDA is open to these pre-competitive interactions. The other program at CBI that's focused on new drug development paradigms, they have an active collaboration with the EMA. They actually piloted an adaptive licensing pathway in the EMA that was driven by CBI in that space. And so they're very open to these types of interactions that can be done in this way.
Yeah. And before we had the panel meeting, Rena from Frost & Sullivan presented an intriguing view of the future in 2025 vision. Is that how you see it as well? Because you've got a different way of shaping things, but I'm curious, is this I don't want to cause any rivalry, but how do you feel about the future?
In my experience, the industry moves very slowly, right? And I think that's probably because it's a highly regulated industry, and regulators are very risk averse, right? I think one of their first mandates is safety, right? And so if there's at all a possibility that something will impact patient safety, they will not adopt it, right? So I think that technology change, as much as we would like it to happen faster, will always be slow, unfortunately, in this industry, unless we can build ways for, collaborative ways for us to generate data and move things forward that way, because I think it's really based about data.
And there's one particular slide that I really loved, which was really about artificial intelligence, where you've got IBM Watson Health, you've got Google, you've got Microsoft Next, all looking in and describing things within the framework of artificial intelligence, helping to make those decisions easier. Do you see that being a major thing in the next few years?
So, I mean, I think, yes, ways that we can make decisions better and augment our current decision making will always be welcome. I think, again, if we think about it from a regulated industry perspective, they're always going to ask the question of what is the potential impact of this new technology, and how does it, is it actually make a safer, better product using it, or are there unintended risks as a part of it? I think implementing testing is maybe a good example to think about. That if you try to implement a new test, you may want to replace an old test. But for a while, you'll have to probably do both. Right? So there's this higher burden on you initially to meet these needs, because the regulators want to be very, very clear that this is not a risk. Once they've had a lot of data to show them that this is not a risk, then maybe you can get rid of that technology. And I think it's going to be similar with things such as automation and AI, in that they'll want to see them as they get implemented to augment current approaches, but they won't be replacing anything until they have a very strong assurance that that's not an added risk to the process or the patient.
Thank you very much. Because I heard the bell in the distance, I feel as though my time is up. We have Prem's timetable to be really be aware of. I'd like to say thank you ever so much to our panelists, and may we all give them a huge and thank you to one and all. I think you've had a very interesting day about biopharm with diverse talks, different speakers. I think it's been a great day, and thanks very much to Prem for organizing it. Prem, the floor is yours.
Okay, ladies and gentlemen, please give them another round of applause. Please leave the stage. Yeah. So, ladies and gentlemen, I trust the summit today, we have come to the end of the summit. I trust the summit has given you great insights, actionable ideas, and new friendships. We from Shimadzu, we are very committed to the pharma and biopharma industry, and we will collaborate with you as much as we can to lead the biopharma revolution together. Shimadzu would like to express our sincere appreciation to all the speakers and moderators by presenting a memento. I would like to invite Tanigaki-san from Shimadzu Asia Pacific to come on stage to personally hand over the memento to all the speakers and moderators. Tanigaki-san, please. So, ladies and gentlemen, I'm going to call the speakers and moderators one by one, so please give them a round of applause, starting with Dr. Paul Baron, keynote speaker of Shimadzu Global Pharma Summit 2017. Remain on stage, Dr. Baron, please remain on stage. Xiaoping, you're not doing your job well. And next, can I have Dr. Yoshia Oda on stage, please? Next, can I have Dr. Tirana Jivapaisatpong from Thailand? Next, Dr. Ravi Shankar Kasturi from India. Next, Dr. Jun Liu from China. Next in line, Dr. Alok Sharma from India again. Professor Gerard Hofgartner from Europe. Dr. Michelle McIntosh from Australia. Ms. Renu Guru from Frost & Sullivan, Singapore. Professor Chan Lai Wah from NUS, Singapore. Next we have Shimadzu Biopharma hero Neil Loftus. And last but not least, the person who gave us the presidential address, Dr. Teruhisa Ueda. Okay, so all of you, please take a group photo. Ladies and gentlemen, please give them another round of applause again. Now, please remain on stage. Please remain on stage, okay? As you all may be aware, Shimadzu has won the Mass Spec Company of the Year award. You can see it over here. 3 times, 3 years in a row. And do you know that we have also won another big award last month from Frost & Sullivan? It is called the Visionary Leadership Innovation Award for combining analytical and medical technologies together. In fact, Shimadzu is the only company which has got both the medical and analytical innovations and technologies. And this award will be presented to Shimadzu right here, right now by Ms. Renu Buehler. Now, do you have the award with you, ma'am? Okay, now can somebody pass the award to, because it's a surprise, okay? Can somebody, again Dr. Xiaoping is not, this is supposed to be done like moments ago. Okay, now, so can I please call upon Dr. Ueda in front? Ms. Renu, please come in front, right? and Dr. Ueda. And at this junction, ladies and gentlemen, I would like to invite Mr. Maruyama, the big boss for Analytical and Measuring Division, to come on stage from Shimadzu. Ueda-san and Maruyama-san, please get this award together from its Radio Bureau. Ladies and gentlemen, once again, a big round of applause. Oh my God, okay. That was exhausting. Right. Okay, ladies and gentlemen, now we will have a group photo. Okay, so dignitaries, please come down the stage. We will arrange the stage for a big group photo. So please come down the stage one by one. Thank you very much. Team Shimadzu, can you please set up the stage for the group photo? We will have a group photo. While we are setting up the stage, I'll just like to inform you that tonight we have got a very big Shimadzu Pharma Summit Gala dinner. Okay, it's at a mountain in Singapore called Mount Faber. Okay, there's only one mountain, it's called Mount Faber. So we have blocked the whole ballroom on top of the mountain, and I believe that immediately after the photo shoot, my colleagues will be giving you the exact timing to assemble at the lobby. We have got 4 big coaches to bring every one of us to the dinner event. Okay, now are we ready? Okay, Dave, please.
Oh, okay. So for photograph taking, we have our Shimadzu staff to come on stage first. Dr. Ueda, Maruyama-san, Tanikaki-san, Nishimoto-san, and Fujino-san. The rest of the speakers and moderator that you have received the appreciation gift just now, please come on stage also. You will be seated. Okay? Speakers and moderator, please come on stage now. Please sit in. Okay? It's exactly 16 chairs. Okay? Everybody? Neil, please. Okay. Ready? Okay, good. So, rest of us, please. Everybody come on stage. Okay? You can just come on stage. Okay. Either you, all of you will stand behind the chairs, okay? And we also can be seated, seated on the stage. And some of them will sit on the floor later. Okay, please. Everybody come on stage, yes. Yeah, please squeeze yourself to the center. Cameraman, where's the photographer? Okay. Okay, some of you can sit on the stage. Yeah, no problem. Yeah. And the rest of the Shimadzu staff, you can sit on the floor, please.
That's right, the floor is clear.
Okay, come on, everybody. Or squeeze to the center. Everybody, please sit down. Okay, make sure the after you means cannot see you already. Please squeeze inside. Imamichi-san, we can't see you. Nishimura-san, we can't see you. You must move in.
All set, go.
Make sure everybody is comfortable, okay? Make sure you can see the camera. Okay, make sure everybody can see the camera. Is it okay? This side, squeeze a little bit. A little bit more, don't worry. Two ladies cannot, he said so sorry.
Okay,
Come
this
in
is,
front,
what,
come.
this is what we're going to do. The first take. The first take is going to be a very serious and corporate take. So everyone, look serious. This is the first take, all right? We're going to be doing a few rounds. So the first take, look serious, look professional, and look corporate. All right? Okay? So this is the first take. Just behave professional. 1, 2, 3. Okay, now we're going to do the second take with a smile. Huh? So at the count of 3, you just smile. Okay? Just what I want, you don't smile. You look professional, you look serious. So now we go for the smile. Okay? The Shimadzu smile. 1, 2, 3. There. Alright? And the final one, at the count of 3, do funny faces. Punch up in the air. Shout all together. 1, 2, 3. Shimadzu. Okay? Then we're going to take. Ready? Oh, okay. Okay. Yeah. Ready? At the count of 3. 1, 2, 3. Shimadzu. One more time. 1, 2, 3. Shimadzu. 1, 2, 3. Ladies and gentlemen, give us a big round of applause. We'd like to remind you, 6:15, level 1, tower 2, that's where the buses will be there to bring you to the gala dinner. We'd like to remind you, 6:15, level 1, over at tower 2. We'll see you at Joel Box.
Today is gonna be a good day. Don't care what anybody else say. Oh, I don't need a fortune cookie to tell me the way I'm feeling. Gonna be a good day. A good day. Woke up, spoke up. Girlfriend want me to drink too much. I feel good deal. Hang out with the bass on the party bus. Memories, it's still best to me. I regret nothing. Today is gonna be a good day.